And Catherine, there's been huge speculation for a while now about whether or not the EU will go ahead and block vaccine exports. Tell us what those EU leaders did agree on during that summit yesterday.
Exactly. The proposal to block exports came from the European Commission, and then it was put to the EU heads of state and government. They were the ones who were getting the final say on this. And basically, yes, as you said, these heads of state and government say they are prepared to block exports of some vaccines in certain conditions. So we're not talking about some vaccine blockade here. It's some vaccines in certain conditions. And those conditions are where a vaccine producer is not meeting commitments that it's made to the European Commission. And this all comes in context of the company AstraZeneca citing production issues for the last few weeks and failing to meet the contracted dose levels that it had agreed with the European Commission, all the while still delivering all of the doses that it had agreed with the United Kingdom. So AstraZeneca had signed up to deliver 120 million doses to the European Union by the end of this month, a couple of days' time. But actually, they're only going to hit 30 million doses. So any ban would be, of course, most likely, given these figures, to impact AstraZeneca exports from the EU. And Ursula von der Leyen made that clear, the head of the European Commission. She directly referred to AstraZeneca. I could quote her. She said the company has to honour the contract it has with the European member states before it can engage again in exporting vaccines. Now, also joining her on the sort of playing hardball camp was the French President Emmanuel Macron, speaking out firmly in line with Ursula von der Leyen. But not all member states are quite as full on as those two. There's some skittishness and hesitation, I think we can say, including from the Netherlands, a small but weighty country in the European Union, and one where there is a plant producing AstraZeneca vaccines. Its Prime Minister Mark Rutte said that he would enforce an EU export ban if called upon to do so, but he made sure he's not keen on doing that. He said he doesn't want to get into some kind of row that could disrupt global vaccine supply chains. Pointing out that, for example, raw materials that are used in the Pfizer vaccine, some of those are imported from the UK. There are talks underway with London and Brussels, and Mark Rutte at least said that he is optimistic that there could be some kind of agreement and a bit more harmony between the two capitals by tomorrow.
And of course, the reason all this is happening is the fact that Europe's vaccination campaign is very slow, is very sluggish. It's lagging the UK, it's lagging the United States. Are we going to see it pick up the pace anytime soon?
That's certainly the big hope, isn't it? All around the European member states. 4 vaccines have been approved by the European Medicines Agency so far. 3 of them in use already. The Johnson & Johnson vaccine expected to come online, so to speak, in April. And the European Commission says they've got some big numbers. They've secured 2.5 billion doses so far, but not all of those doses are going to be available immediately. We know they've got to be produced, and we've seen the supply problems so far. So Ursula von der Leyen said that in terms of the next 3 months, the European Union is going to triple its vaccine supply. And she's still saying that she's confident that 70% of EU adults will be fully vaccinated by mid-September. So just to give you some figures about where we're standing right now, so far, fully vaccinated, we've got 4.3% of the EU population having 2 doses of the AstraZeneca or Pfizer or Moderna vaccines. The UK actually behind on that particular metric, 4.1% of the UK population fully vaccinated, and France even further behind, 3.7%. But yes, Ursula von der Leyen, for her part, seemingly confident that those numbers are going to pick up. Of course, it's not just about the vaccine supply in the European Commission. It is down to each individual member state to roll out the vaccines. They each have different healthcare systems. None of them has a healthcare system that's quite comparable to the UK's NHS, the National Health Service. So there are many, many reasons and factors why there's a different speed of vaccine delivery in the different member states. But certainly these vaccine supply issues are really at the root of a lot of them.
Catherine, thank you very much indeed. Catherine Nicholson there.